What's up, guys? So I'm gonna do things a little bit differently this week. I just got done with a really long shift today, and I wanted to talk about a couple of things that were on my mind that I think you guys might find useful. So we got bombarded today because it apparently snowed in the south, and I thought it wasn't supposed to do that, but everybody that had appointments at their doctor's office couldn't go, and we had a lot of sick patients here today. So what do you guys do when you have just very complicated patients, when you have very sick patients? How do you handle those patients? So, like I said, today was crazy. We had an influx of patients. And right off from the get go, the first patient I saw, he was just doing very bad. He was hypoxic, encephalopathic, and I stabilized him, left the room immediately after that, brought my physician up to speed, and I told him that he needed to come in there immediately because this patient's going to need some advanced care and some advanced procedures that I'm not going to be capable of doing. So we worked on this patient together, and then I had another patient shortly after that that was also very complicated. He presented with a solitary third cranial nerve palsy, and it had been going on for 24 hours. I really wasn't quite sure. I didn't have a great explanation for it. Everything came back normal, and I had my physician get involved again, reassess the patient, and we kind of talked about it collegially and devised a plan. Well, the plan ultimately was that we weren't sure. So I consulted a neurologist at a nearby hospital, and we ultimately needed to get the patient over there. I had a couple other patients who I also was just unsure about today, and I had to ask my physician questions again and again. And it seemed like today, more than any other day, that I really was leaning on my physicians. I wasn't sure what was going on with some patients, or they were complicated, like I spoke about, and I needed their help and assistance. Well, what do you guys do when you have a lot of complicated patients? It's okay to ask your physicians questions. Do you feel like you're ever a burden on your physicians? Because if that's the case, you really should never feel that way. And if your attendings are making you feel that way, maybe have a conversation with them about that, because ultimately we always need to do what's in the best interest of our patients. So if we're not sure about something, then we need to consult our attendings. We need to consult our neurologist. It's okay not to know everything, and it's okay to be unsure. What's not okay, guys, is to have a patient that you're unsure about and not involve your physician if you are only not involving your physician because you feel like maybe they'll think you are unintelligent. Well, no, that's not the case. It's it's not a sign of weakness to involve your physicians. It's a sign of strength. They look at that and they appreciate that you have the knowledge and understanding to know your limitations, to include them, and you're virtually an extension of your attending. As far as I go in the ER, my role is to help out as much as I can, and just make things easy for him. But if you are solely not coming to your attendings because you are worried that they might think you're inferior, you need to rethink that, because they will not think that of you. So it's okay not to know it all. It's okay to need help. But remember, guys, it's not okay not to ask questions for fear of looking maybe unintelligent in front of your attendings. So tonight I'm going to go home. I've got a couple things to read about that I need to learn more about. And I want to challenge you guys, if you're working in the ER setting and you have a complicated patient, of course, get your attending involved early, but don't just wipe your hands clean from the case. You know, the attending will take lead when they need to, but stay involved in the case, because if you just wipe your hands clean and then walk the other way, yeah, they've kind of taken care of your problem off your hands, but you missed a huge learning opportunity. You've missed seeing how they're interpreting the labs, what they're doing next, their clinical gestalt. Is this patient going to crash? Because they've probably seen more crashing patients than you have in your life. So if you stay involved with those patients, then you're going to learn so much more. If you have complicated patients in the outpatient setting, like family practice, OBGYN, maybe you're in cardiology, endocrinology, and you're unsure about a patient and you have to admit them to neurology, or just another field of medicine that's outside your scope of practice, and they're complicated or a difficult patient for you, well, don't just wipe your hands clean from that patient. Request the notes, stay up to date, ask them how they're doing, read their notes, and learn how they worked up this patient. So today was a complicated day, but it was a good day. I learned a lot today. My knowledge has exponentially grown, and I'm really looking forward to work tomorrow. Got some things I need to read tonight up on, and if I could live in a hospital, guys, I probably would. I love medicine so much. I love teaching you guys, learning new things, talking with others that know more than I do about a lot of different subjects. So I want to challenge you guys. When you have complicated days, use those days to expand your knowledge and grow as much as possible because, whether you're in family medicine, OBGYN, endocrinology, cardiology, we're really all in this together to help out patients, and it's a team approach. I'm happy to be on your guys' team. I'm happy to send all my patients to whatever field of medicine it is that they need. I just thank you guys for listening, and stay tuned for next week. If you guys have any questions, as always, please email me at gray@physicianassistantboards.com. That's GRAY at physicianassistantboards.com. Until next time.